great question, let me talk about Medicare generally. Medicare, I think, is one of the cornerstones of our social safety. The basic idea is you've been working all your life, you retired, just like you've got Social Security that you can count on, you've also got health care that you can count on. You're not going to go bankrupt just because you get sick. But in the same way that Social Security has to be tweaked because the population is getting older, we've got to refresh and renew Medicare to make sure that it's going to be there for the next generation as well. And the key problems are not just that more people as they retire are going to be part of Medicare. The big problem is just healthcare inflation generally. The costs of healthcare keep on skyrocketing. Now, the way we've been dealing with it, which I think is the wrong way to deal with it, is basically under reimbursing our providers. The right way to deal with it is to work with the providers to figure out how can we make the system less wasteful, more efficient overall, and that way we're paying, your boss, if he's spending $1 on care, he's getting reimbursed $1, but we're also making sure that the care he's providing is exactly what the person needs and high quality for a better price. And that's a part of what healthcare reform was all about. I'll just give you a couple examples. One of the things that we were doing in Medicare was we were giving tens of billions of dollars of subsidies to insurance companies under the Medicare Advantage plan, even though that plan wasn't shown to make seniors any healthier than regular old Medicare. So we said, all right, we're not going to end Medicare Advantage, but we are going to have some competitive bidding, and we're going to force the insurance companies to show us, well, what value are you adding? How are you helping to make these seniors healthier? And if you're not helping, then you shouldn't be getting paid. We should be giving that money to the doctor and the nurse and the other people who are actually providing care, not the insurance companies. Well, there was a lot of hue and cry about this, but it was absolutely the right thing to do, because now we just found out the actuaries for Medicare said the changes we've already made has extended the life of the Medicare trust fund for another 12 years, which is, by the way, the longest it's ever been extended as a consequence of a reform effort. So we've made Medicare stronger just with some of the changes that we've already made. But you're absolutely right that we're going to have to keep on making these changes to continue to make it stronger. And that will affect not just Medicare, it will affect the entire healthcare system, because there's no doctor out there who doesn't see Medicare as the 800-pound gorilla. If Medicare is saying you've got to improve your quality and efficiency, then they will, because they've got a lot of Medicare patients. But they also have a lot of regular patients. So hospitals, doctors, everybody starts getting more efficient as Medicare gets more efficient. The key is making sure that we're not just cutting benefits. And frankly, this is an argument that I have with my friends in the Republican Party sometimes. One big change that some of them have advocated is to voucherize the Medicare system. You basically, instead of, once you have Medicare, you knowing that you can take that and go get care anywhere you want, we would just give you, all right, here's whatever it is, $6,000 or $7,000 or whatever. You go shop and figure out what kind of best deal you can get. The problem is that if Medicare costs if healthcare costs keep on going up, but your voucher doesn't keep on going up, you're going to be in trouble. And suddenly you've got seniors who find themselves way short of what they need in terms of providing care. We've got to change how the healthcare system actually operates. And that means more prevention, more preventive care. It means better, that we reimburse people for checkups. It means we reimburse doctors when they're consulting with people, on things like smoking cessation, weight control and exercise. There are a whole bunch of things that can make us healthier, reduce our costs overall, but unfortunately the system doesn't incentivize it right now. We need to change that. Okay? All right. Anybody have any last burning question? That was technically the last question, but this has to be like one that you're just, man, I really need an answer for.
It's a pretty general question.
Okay, go ahead.
It's a very general question here. My name's Colin O'Reilly. It's my dad, Mike. I work on Wall Street. I was wondering what kind of changes we can expect to see in reform.
Well, here's the essential components of Wall Street reform that we set up. Number one is that we've got we had a system in which there was huge amounts of leverage that banks could take. And what leverage means is if they got $1 in deposits, they were making a $40 bet using that $1. Which, when times are good, means you're making a lot of money, right? You're putting $1 down of your own money and you got $40, and when the market's going up, you're making out like a bandit. But when the market goes down, when it starts deleveraging, you're in trouble. And that's basically what happened with Lehman's and a lot of these other companies. So one thing that we've said is that we've got to have, for big firms that are what we call systemic, that if they go down, the whole system could go down with them. We've got to have a better check and say, you know what, you've got to control a little bit how you work in terms of leverage. You've got to have enough capital, actual money, to cover the bets that you're placing so that you're not putting the whole system at risk. That's number one. Number two, there's a whole derivatives market out there, which frankly, even the bankers don't completely understand. But you've got trillions of dollars, and if you work on Wall Street, you're familiar obviously with the derivatives market. I mean, you've got trillions of dollars that are basically outside of the regulated banking system. And people didn't know who's making bets on what. And what we said was that derivatives market, it can continue, but it's got to be in an open, transparent marketplace so that everybody knows, who is betting on what. And we're very clear about who the various parties are in these complex derivatives transactions. That means the regulators can follow it a little more closely. That's number two. The third thing that we did is we made sure that we don't have taxpayer bailouts again. So we've set up a system whereby if a big firm gets in trouble, we're able to essentially quarantine it, separate it out from the rest of the pack, liquidate it without it spilling over into the system as a whole. That's the third thing. And the fourth thing is having a consumer financial protection agency that is really going to do a good job making sure that consumers know what they're getting when it comes to financial products. I mean, when you buy a toaster, there's been some assurance provided that that toaster will not explode in your face, right? There are a whole bunch of laws in there. People have to do tests on the toasters to make sure that nothing happens. But if you buy a mortgage that explodes in your face because you didn't know what was going on, everybody acts like, well,